Hello to all my classmates and instructors for the Patient-Oriented Outcomes course in the online DAT program. I'm going to attempt to work through my video presentation of my final project for the quarter. Lead off by saying I feel like I learned a great deal during the course of this class, and obviously was introduced to a number of topics that were new to me. I think I have a significantly better handle on those topics now than I did at the beginning of 10 weeks, and hopefully I'm able to illustrate that through both my written presentation as well as the video that I'm currently recording. Rather than go through the entire paper again, since you guys have that to read, I want to kind of talk about the patient in this scenario and kind of the interaction of this course with my own clinical practice. Dealing with college basketball, I chose to talk about patients with knee pain with no specific acute mechanism. I think that's something that's seen commonly in athletics and commonly in college basketball players. Something that I've dealt with quite a few times in my clinical profession as well as here recently. So it was something that was obviously of interest to me. The other thing that I really wanted to highlight was my plan for implementation of utilization of patient-rated outcomes measures in my own clinical practice. One of the things that I speak about in my paper that I'd like to kind of talk a little more in detail about here in the video is some of the barriers that I see to utilization of these measures and things that I feel like we experience, and part of the reason that I think the use of these measures has been so stunted in our profession is that there are a lot of people who frankly are resistant to change all over the world and in our profession, and I think that anytime you have an opportunity for change, it's going to be met with some resistance. We've talked at length in the discussion board post about the issues concerning time restrictions and requirements to utilize these tools, and I think that would be one barrier in this particular project that I've addressed in my paper. Another would just be the fact that it's something new and something different that a lot of athletic trainers have not had an opportunity to learn in an organized academic setting, and also something that was not a point of emphasis during many of our own education processes. So it's something different. It's something that we haven't learned about, something that a lot of us are uncomfortable with using because we have no experience or very limited experience in using. So I think that any plan for spread should incorporate those two major things and should address those things in a manner to allow clinicians to become comfortable with the tools, and then allow those clinicians to expand the patients that they utilize those tools with. And those are the two things that I tried to address in my plan to recognize that it would be very difficult to take clinicians who've never used these tools and require them to use them 100% of the time on 100% of their patients. I hope that by dealing with a very isolated and a very specific patient segment of our patient population, we can allow opportunities for clinicians to grow and become more comfortable with the utilization of these tools, and then move into a more broad-based usage of patient-rated outcome measures across the board. I know I spoke in my paper, and I identified two tools that I use and evaluated for the purposes of this project, but there are a number of other patient-rated outcomes tools that can be used for knee injury. And again, my decision to use the two that I did choose, the International Knee Documentation Committee Subjective Knee Evaluation Form and the Marks Activity Level Scale, my decision to use those two tools was not an indictment on the other tools. Frankly, I chose them because I felt they provided me the best opportunity to complete this assignment, and provided their own challenges, and they gave me a great opportunity to kind of review my own knowledge of patient-rated outcomes measures, and I thought they afforded me the opportunity to really try to grow in the respect of my own comfort level in using these tools. I think that's about it. I would love everyone's feedback on my paper, my project design, and pros, cons, and again, I'm very pleased with the content and discussion that we've had over the course of this semester, and look forward to hearing back from you about my final project. Thank you very much.